Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now I'll invite to the stage our next speaker, who is Kashmir Besla, who is a registered clinical counselor. She runs her private practice in Surrey. And the topic we're going to talk about that we points to us like our stress, how different parts of our life is affected by it. She's expert in that, and she's going to shed some light how we are going to reduce the stress in our life and make a better quality of life. Salutations. I wish to say thank you, first of all, for starting this program. I was not able to be here this morning. When I came here, I noticed there are more than 200 people here participating. I felt really happy. When I look at my own community, they come and join these programs. They should be here to learn, to participate, because these programs are designed for you. And if you don't watch it or online or in person, so I thank you for participating. First of all, my Panjabi is not that great as Green's, but she spoke very well in Punjabi. First of all, let me tell you something about myself. I'm a registered clinical counselor, and sometimes we don't know what exactly it means. Clinical counselors work as we talk to people, using talk therapy to help you. Our work, our job is to help you with your mental health. So our mental health is what we think, how we think, what things affect our life, and how we can correct those or amend those. Oh, sorry, I forgot this. What we're going to cover in a little bit of time. I know you had a lot of information this morning. You heard about the heart, and Vineet told you about the food or the diet, and I'm going to talk about mental health, what exactly it is, and how does it affect your heart. So what are we going to cover? First, we're going to see if there is a link can we say if there's a link between stress and heart disease? There are a lot of research done on this. Second thing we are going to cover is what can we do to, people are really stressed, life is too busy, they don't have time for exercise, just going to work in the morning, then coming back home. So we're going to look after that. Second thing we are going to look at when we feel anxious, how it affects your heart. I'll try without screen, without looking at my notes. We'll start, and they will fix it. We're going to look at if there's a link between mental health and heart disease. And I'm going to answer you that question. What do you think? Is there a link between that? How do we think and what we think? What we think, it does affect. It does affect. How does it affect? How it affects our body reacts how we think. It affects our blood pressure. It affects things, inflammation, swelling. There are a lot of medical things. I said I'll start with the brain, but there are a few things that affects it. We can't say one thing doesn't affect the second thing. But what is mental health? We hear about it every day, on the radio, TV. What is it? Take care of your mental health. What exactly is it? It is, your physical health and mental health, that you can keep that in line. When you don't keep it in line, what effects do we get? We lose energy. We are unable to sleep at night. We start eating less, or we start eating wrong things. When we are stressed, we make bad choices. There are other mental health issues with that. We think about it, somebody had a depression, he's very anxious, doesn't get out of the house, or PTSD, had some sort of trauma, and they had some effects of that. Then I think about it sometimes. I don't want to offend the doctors, but when our leg is hurting or it's broken, we go to the doctor right away. The doctor, I have this problem, can you fix it? I've been doing this for 25 years. Still, I teach people, and when people emotionally, psychologically, they have issues, we have certain feelings, depression or anything, why don't we talk to somebody? First of all, we keep it as a secret. We don't want to disclose it to anybody or share it with anybody. But sometimes that makes the situation worse. As I said, sometimes we go to doctor for physical issues. You can also seek help for mental issues as well, for depression, anxiety, and issues like that. But I have also seen nobody teaches us that easily, how to deal with our emotions, how to handle it. We mostly listen to this, we hear it, keep it inside your house, don't share it with anybody outside. But I want to tell you that if you share with somebody, there is so much help available here. When we had lunch break, some participants came to me, and I want to tell them any type of health you need, you can get it here. And you just have to ask somebody. And if you say, I don't have any help, but there's all sort of help available, we just need to get out and ask somebody. So we need to change that. The mental issues, we don't talk to others about it. So the issues, if we talk to therapist, counselor, we can go talk to them. If we cannot afford to see a professional, there's another way out. We can talk to our peers, the family members. We should have somebody that we can completely trust and talk to. The person who can hear us out properly and who doesn't pass judgment on us. Like sometimes you'd feel somebody, when somebody's suffering, they think such and such person is going to judge me. They're going to think less of me, and they're going to divert it to some other way. They don't want to show themselves as weak. We want to show ourselves as strong. We need to change that stigma. We have talked about emotions. What can we do to manage our mental health? There's so many things. As you came today, we call it community. With your own community, you came to learn. It's Saturday, you're spending whole day here. You could have gone somewhere, but when you get out, you meet somebody. That is also a factor that helps us, our mental health. You know, not here. In England, there's a whole ministry for loneliness. They know some old people, they feel lonely in their life. The kids are gone to work, grandchildren are gone to school, and then seniors are left alone. They formed a ministry how to help the seniors, how can improve their mental health. So you might have heard that so and so wife died, husband died, then pretty soon after they died as well. But I can say it's a broken heart that can also kill you. So that's why mental health is important. When we don't look after our mental health, sometime we go into a dark place. You start thinking about suicide, or you don't want to live anymore. Life is not worth living. So first of all, spend time with positive people and share your feelings. Don't feel lonely. There are always programs at the Gurdwaras or senior center. There are so many different ways. And it's also important to enjoy your life. Don't think that, I have this to do, I have to do this. When we're sitting here, but we're thinking about something else, once this is done, I need to do this and that at home. But we need to look at wherever we are, we should pay our full attention with mindfulness to that moment. We're sitting here. Nothing else should come to our mind. We should enjoy the moment. We should just enjoy that instead of thinking about something else. How else can we improve our mental health? We can do some volunteer work. They say people who volunteer even week or 2 hours in a week, it affects them in a better way for their mental health. When we volunteer, we know, then somebody's waiting for you, and that I'm going to spend some time with somebody. That helps them as well. If you're active, you should join a sport, play tennis, go swimming, and later on in your old age, you can go like ride a bike. Doesn't matter the age. It's good. What else can you do? You can look at your lifestyle. How can you make it better? Not to smoke. If you drink, drink carefully. And there are 24 hours in a day. At least 30 minutes a day. Find for yourself. When you're sitting all the time at the chair or watching TV, every half an hour or so, get up, move your legs. If you can do it, you can walk 30 minutes a day. That's the best exercise. You don't need any special equipment to do this exercise. Just need good shoes and walk, look at the weather, go to the park. If you start walking 30 minutes every day from now on, it will help you so much, your mental health, your physical health. And I talked about TV, laptops, screens. There's so much on. If you can reduce that, that's also better. Because you're spending too much time instead of screen, we're just sitting. We don't stand and watch TV or phone. We're just sitting. So we should try that as well. Then when we're using these devices, use it moderately instead of, sitting in front of TV for 8 hours. Spend time with the family. It's very important as well. To find that time. Make healthy relationship. That's also very important for your mental health. Proper nutrition, we talked about that. Make good food choices. Maybe you don't know that our oral health, brushing, flossing, it's also important for our health. That helps us. Brush in the morning, brushing after eating something, and before going to bed at night, brushing, and that affects it as well. Drink a lot of water, drink it as much as you can. Go to the doctor. If you don't have any issue, that's a good thing, but at least once a year, get a complete screen done get a checkup done from the doctor. And then also look at your family history. In your family history, what illnesses or diseases you have, what you can do to keep yourself better. You can learn so much from your family history as well. Sometimes, there are bad times in life, but, you can always deal with that bad time. Somebody just sent me a message that you got only 4 minutes left. Meditation, yoga, doing prayers, These are very simple things. If you enjoy it, do it. Take deep breathing. Some people have cats or dogs, pets. It's very important for your mental health. You don't feel lonely, and you have to go outside with them if you have a pet. And empower yourself with knowledge. Learn whatever you can. And maybe somebody else already explained. People, some people think, my body is not well. So if your stomach is hurting, there's pressure you're feeling at heart, if you have any feeling, if you're tired and you have more stress, don't ignore it. Sometimes you learn about this later on. Somebody got a heart issue. Okay, no, we'll talk about questions later. And lastly, even if it's diagnosed, if you have some issues, health issues, you don't need to worry. As I told you, what you think, it affects your body. So if you have been diagnosed with something, if you have any heart issues, seek help and improve your life. There are so many different ways to assist you. And sometimes that happens in the family. Sometimes we feel stressed about that as well. Looking after somebody, father and mother, we have to spend so much more time, but we need time for self-care. So overall, I'll just say that we have learned there's so many different connections. Our body and mind is connected, and we can always make good choices for our life. And you can start it from today. Think about it. Today is your first day. You came to this forum. Whatever you picked from here, even if you apply these one or two things in your life, it will change a lot. So our mental health, that to seek help, it's don't feel bad about it, don't feel embarrassed. It is there for you. And find some, just don't think that only you have that experience in life. Everybody goes through stuff like this. The research tells us that everybody has depression or episode of depression in their life at least once. So everybody in the world goes through this. So there's a help available for it. So the good thing is the help is there. We just need to ask somebody to get that help. Thank you.
Dr. Chima, first question for you. The question is, the medication are given after the heart operation. How is linked with the dementia or or Alzheimer? The medications that are given after the heart operation, is it linked? Is it linked with the dementia or forgetfulness? No, there is no link. If you are already have early dementia or depression, then it could happen. So we all are in confusion. The blood in our body, cholesterol, sugar, or the other things that those things that are reason for stroke or heart attack is not only affect the heart but it affect the whole body. So overall, you have to manage your health in this country or any other place. There is no doctor who can prescribe the medication that could be that could damage your health. So take care of your health. Yes, is healthy approach is very important. There was there are billions of people who don't have doctor, they are managing, so you can manage. We are depending too much on the system or on the doctor, and that's damaging. The next question is for Kashmir ji. The question is, if there is so too much stress So how it affects the heart? In the presentation, we agreed whatever we think, it affects the whole body. When we are stressed out, we know on our heart and other organs get affected. There is a connection. So we also talk about what we can do to manage our life more. So if we change few things in our life, we can slow down our life. Or if there is a issue, we can go talk to someone, and it really makes a difference. Thank you. Next question is for Vaneet. This question came many times. How many times we can have tea during day? Okay, because the answer to this is lengthy. So please give me that much time, and if I go over, let me know. People who don't know what is a registered dietitian, I tell for their information, registered dietitian, they are part of Canadian healthcare team, and our training, our education is a different. It's about holistic health and diet, how they are linked to each other, how they're connected. That's our expertise in healthcare. If your questions are related to that or any diet, then you can talk to the dietitians. Dietitians are present in public health. With the healthcare department, they work with them or privately. So you can talk to dietitian, because how much tea you can drink, it depends what you put in the tea, how much what percentage of milk you are using for your tea, how much sugar you are putting in, it depends on that. Other than that, our science, it doesn't consider tea a bad thing, but if we are having it several times a day, so what material, what things is replacing our diet, so that will affect our health. What tea is replacing in our diet? If you're drinking 2 to 3 cups a day during in the morning and didn't eat breakfast, so the balance in your diet cannot be achieved because you missed a meal. Sometimes we drink tea and miss the meal. That will affect your health more. That's why the question how many times you can drink tea, the answer varies depending on your lifestyle, age, diet. But if you want a short answer, I would say that the tea in our culture, we only drink that time when we sit down and we speak from our heart. We share our things. If you have chances, if you are getting chances just to lighten your heart, talking about things, then, but if you are drinking tea because your life is so fast and you cannot avoid it, then and the other things like if you want energy, more nutrition, information, sleep, health, you can should be careful about that before there is a number to talking call about tea or decreasing the thank you amount of very tea. Much. I hopefully I answered your question. The talking about tea, do read the history about tea, 150 years old. People, countries, people drink tea. It's not an issue. It's a kind of antioxidant in the body. But we shouldn't we talk about that. But the addition we make, sugar and milk you put in the tea, that's the one. If there is issue about intestines, your stomach ulcer or something, but avoid the hard, like the one is very much boiled, and avoid that. But if you take tea 2 3 times It's a social kind of thing too. If you are read the Indian Punjabi history, the colon cancer was very rare because everything was diet based. So don't worry that much about tea. The main issue is everything else we do. Yeah, how much you are eating, what you do, how if you eat laddus, gulab jamun with tea, barfi, and then you bring pinni in then the relatives are here. We're not going to stop them from eating. In Surrey, where we are living, look at the shops. Whatever, did you ever ask what you put in these sweets? Did you ever ask? Go ask them. It's not about only tea. How how many calories in one rasgulla? 350. In one gulab jamun, 300 calories. Do exercise, walk, but if you eat two laddus, it's all gone in the drain. So these are the practical things. We are very simple people. So we should be straightforward. No excessive amount of money is also dangerous. One thing you need to remember is whatever restaurant you go to and eat food, I'm sure Vineet will agree with me. Do go see their kitchen, how much is clean, how much they are frying the pakoras in that oil. So all those things very important, crucial. So your doctor, your dietitian is all the specialists, whatever they're doing, do because you are not managing your diet, it goes into drain. Whatever work your healthcare professionals do for you. Look, it's not that we are thinking that there is a profession. You come to my office, if there my it's not clean. So if you are going to a restaurant, have the it's not clean, how you can manage? You go if you go to somebody's house, the washroom is not right, or it's not good hygiene, is smelling. It's not the you have to protect yourself. It's not about that person's personality or anything. Not that anything that's available and you eat it. You are paying for it. You tell them, you ask them, they will be embarrassed about that. Like, wow, how you make the sweets? Look, acid is important for the body in our saliva. It's very important for the absorption. We cannot stop it, but how you manage it, it depends on your acidic food, citrus fruits, oranges, all these categories. Avoid them, reduce it. I missed the talk. You should eat whatever is comes in your fist. Yeah, eat according to time. The SAT. Our people are in a lot of confusion. It's only our diet that's responsible, and where we came from. There is a bacteria in the water. It it sits in our body, and it gives us so much. I don't have time to talk about that because I was late. I didn't hear the whole conversation, whole talk. Control your eyes and your hand, and you will have a good health. I request to those people who send the questions in the morning, they are waiting for it. And if I can please ask those questions. It's from the morning, this question. Silent heart attack. What is silent heart attack? There are blood vessels, there is valves, nerves. Why we feel pain? When the blood is not reaching to heart, the muscles start shrinking. So that's why you feel pain. Silent attack is when our nerves are not working. Because you are diabetic for a long time and you don't know if you actually have a problem or not. The common presentation is not a chest pain that we feel problem, shortness of breath while walk. While I go upstairs, I feel shortness of breath. Then you don't know silently is there is a problem going on in the heart. Silent means you don't know what is going on in your body. Diabetic patients, people who are with high blood pressure, with high cholesterol, whenever you feel shortness of breath, whenever you feel shortness of breath, meet your doctor, get the test done before we do where we're doing ECG. There is no point. Just go for a stress test, go for a scan, and then there is a confirmatory test, angiogram. It's called angiogram. There is no point of going beating the bush. The thing is, if you have excessive cholesterol, excessive sugar, excessive body weight, and if you have problem, then this is silent attack. When you don't know, it's not a magic. It's our body. Its presentation is like that it will not let you know. Next question. There are two questions. One question is, yeah, the cashew, walnuts, triglycerides are more. Is it damaging? If one person is eating one egg per day, is there an issue regarding the cholesterol? And there is a myth about this question. Nuts, triglycerides. There are no triglycerides in the nuts. Triglycerides are in our body. There are things that increase those, and there are things that reduce. If we eat sugary food, anything we eat with sugar, then if you eat the peanuts that are coated with honey or sugar, then we have to be careful with the glycerides. If you wanna lower your triglyceride, then consult the guide. Then eat nuts. HDL are present and they will help you to reduce your triglycerides. But how much? Whatever, that's the handful, like in your fist, and like not like we are eating cashew burfi, dry roasted without sugar, without salt. 4 5 almonds or cashew or walnuts. So these kind of things you can eat. The second question is about the eggs. Before there was a myth that the eggs have cholesterol, but the new science and evidence is you can eat eggs. That's what it says. Though you don't have to worry about your cholesterol, like how much eggs you eat. So maybe one egg a day, 7 eggs per week is moderate, and you can eat it. The next question is for Kashmir ji. If you want to see a counselor, how we can see a counselor? Do we have to go to doctor, or how we can see a counselor? Is it free to see the counselor? You online, you can go online. BCACC, our association, but those services are costly. You have to pay for it. But when you are working for some business, you have extended healthcare benefits. You can get your death, you can buy glasses, you can clean your teeth, you read your package, mental health services, to read that if there are mental health services present. Sometimes you have to pay from your pocket, and then the counselor give you a seat, and then you can claim. You will get reimbursement. If you don't have that, and if you can't afford that, so then you can go to community services. They are low cost or free counseling service. There are available in the community health, as I told you earlier. So you have to advocate for yourself, and you have to search, and you will get a service from somewhere. The next two questions are for Dr. Chima. Home, it's about home remedies. What are the home remedies? Are good? Are they good? The second question is, and the medication, the allopathy and homeopathy. The people who came from India or Pakistan, we are mostly Panjabi. 60, 70 years before. Did you hear cancer? Somebody dying with cancer or heart attack? All these things we are doing. We whatever we learned from culture, lentils, garlic, ginger, spices, all those things are very important. So considering all these things, in the Western they modified it, gave new name, all our spices. For example, garlic, it blood controls the blood pressure, cholesterol, and anti-inflammatory things. Turmeric is there are capsules, and it will improve your joints. They are very important. Everything in moderation. Second question is also related. If you have heart problem, you are taking aspirin, you are taking turmeric, and your blood will be very thin. Don't hide your medication from your doctor. Tell them, these are the things I'm taking, these are the medication I'm taking. Pay attention. The homeopathic or Ayurvedic medicine doesn't hurt you. No, it will not affect anything. Is for your prevention is very important to maintain your body. The second thing is people who have less money, people who are in South India or near the coastline where the weather is good, environment is good, they use all these kind of spices. They are very healthy. They don't have heart attack. Their complexion is good. So all these things. So our culture, our civilization, our medication here is acute care medication. You tell your doctor you have heart attack, and you will have an operation, but your dietitian is gonna tell you what the things to eat. Before the diet was Mediterranean diet, there were many names here. Thank for you the very diet. Much. The Punjabi diet, even spices. We were having a technical all glitch. Those things still are good. You still explain mental health very well to our audience. Spices and the spices are very important. Mental health is very important. Do you agree with me? A good lifestyle is very important. Our next
We are all trained. We go to the
Dr.
doctor,
Gulzar Chima, who
family
is a
doctor,
physician.
specialist.
Dr.
They don't
Gulzar
have
Chima,
answer for everything. A
2001.
psychologist,
So he
dietitian, talk to them.
presented the
Somebody who
study
can coach you
panorama, June
spiritually.
5th, 2001.
If
Dr.
you go to the
Gulzar Chima,
church and just pray
he
there,
became a mental
that's
health
not going to
minister.
help. Do some
And
yoga, do some deep
and he was
breathing,
a
hot
member of
yoga.
BC.
Avoid that. Yoga is fine,
It's not only
but
BC,
sweating
but in
excessively,
all different
excessive
provinces. He's
sweating is not good.
Dr. Gulzar Chima.
You just have
He is
illusion
one of the founding
that's
directors of
they're
iCON firm.
taking your
For
money.
last 12 years, Dr. Gulzar Chima
Sweating
are
is to
connected with
maintain your
iCON
body temperature,
right now.
to keep it cool. So
Dr.
do yoga, do
Chima
exercises.
is a family
Spices
physician.
are
He's
important.
practicing
So
in the
good
Department of
quality
Family
spices.
Department
Udit,
in
anything you want to add?
University of
Yes.
British Columbia. So
I
I'll
just want to
request
say
Dr. Gulzar Chima to come on the
the real
stage.
medication is your diet. Even in Western medication, or even say in Punjab, the balanced diet is important. The healthy eating, that's best preventative medication. If we bring some balance to it, eat healthy, then we can keep our health healthy. But once you need Western medication, then you should consult your healthcare team. There are many professionals in your healthcare team, and they can give you the best advice what to eat. Based on your medication, they can decrease the side effects of the medication and make it more effective. and we should add that into your diet. When you're taking medication, there's so many foods that you should not be eating because they interact with your medication. So if you don't have any illness or disease, then look after your health and eat what's good for you. And if you have a disease, then talk to your medical team. Tell them you're trying these remedies. And the medicine is holistic these days. They can give you advice that according to our science, this is better. That going to eat more or less, or should you eat more or less? The nuts, the lentils. Dr. Chima, 3 more questions. Then 1 more Kashmir, then 1 from Reed. First question: if somebody has excessive breathing, or they're having hard time breathing, is it lungs issue or heart? People who have asthma, they have different issues. But if you have diabetes, cholesterol, and you're having hard time breathing, especially going up the stairs, that's a big sign that you should see your doctor. It's not a minor thing. If you're having hard time breathing, going up the stairs, that's a big thing. Oxygen is not going to your lungs or to blood. So, it's your lungs that check your heart. And asthma medication, use it properly. Talk to your pharmacist. It's not just you just go and say hello and get the medication. And use the pumps, how to use the pumps properly, how many times you need to use it, pump or anything else they give you. Second question, I see. Second question is, if you're walking and you have shoulder pain, and if it is going on for 10 minutes, for so many years that you have this problem, should you see your doctor? It's a very simple answer. We should understand the shoulder pain and walking has no connection unless it's on the left side. Move your body, be active, some strengthening exercise there, as they mentioned. You're going to get well. No, you're not going to get well yourself. If somebody is diabetic, their muscles, I'm 70 years old. If I'm not walking, I'm going to get sick. The muscles are not going to move themselves. You need to move it and move your joints. And when you're moving, exercising, it's using sugar. It's a simple things you should pay attention. It's not doctor's job, it's your job. Last question for you. If somebody had a bypass, but their feet are really dry now, again, somebody had a heart problem and they had a bypass, they're diabetic, do you think it was heart block? The blood goes all over the body and it goes all over down there, the veins, the blood vessels, everything affects it all the way to the heart and to the feet and other organs, sexual organs. It affects everything. And if somebody has a health problem, had a surgery done, and they're getting swelling, and then they need to control their circulation. When you say go sit at home, don't sit like this. Push your legs up, and then improve your circulation. Lift your legs, do some massage, do some exercise. Best exercise you see to push it. Move your legs and move your limbs. Even when sitting, some people sitting and they're saying, give me water, give me food, give me tea. You should get up and, move around and do some circulation. Most of the people who are sitting here, they are fit. I don't see anybody who's that sick, but activity, you need to increase that a little bit. Some people say, Herline, walk, should I walk barefoot or not with shoes? That doesn't mean anything. Walk is walk. The dirt is not going to change anything in your body. Avoid those gimmicks. Thank you. Another question for me, then for Kashmir Vineet. I got a question. Brand name and generic. Is there any difference between some they say brand name generic? Just Altes or some liquids generic mix one. There's no difference. Brand name medications are only the companies that have their packet. There are so many years per packet. They have patent for 10 years. When that patent expires, then other companies can make that medication as well. So usually brand name, generic, it's the same medication. And just to keep the tablet stable, what they put in there, that's a little bit different. But the active medication is the same. Only thing is different, insulin. Insulin, a generic brand name. It's a biosimilar. Biosimilar means the medication, the structure of the medication, if you look at it under a microscope, it's the same. It's the same medication, and it's built the same, but it's not the same. Got it? Good? Thumbs up? Just want to add something. If you go to the pharmacy and go anywhere, doctor wrote it for you, Altes or any other medication, they're very expensive. You can't afford it. You have limited income. You can ask the pharmacist through your family doctor or directly yourself. Register yourself with PharmaCare. Participate. Your medications will be free. We get stuck in there somewhere. And you say the medication is not fine. All the medications, go get it yourself. There's no problem with it. It's the same pharmaceutical company, and sometimes have a 12-year patent. In India, they make it. It's just up to you. You feel that it's different, it's cheaper. Cheaper doesn't mean it's not good. Next question for Kashmir. Kashmir, if you talk to anybody about your problems, is that beneficial? If you talk to your heart with somebody, does it help? Well, you know the answer to this question. What happens when we keep everything in our heart, in our mind? We don't talk to anybody, we don't share with anybody. Does it affect us or not? Yes. But as we said earlier, if we have tea with somebody, you talk to somebody, you share with them, I'm like this, how are you? Don't you feel lighter? Don't you think, they listen to you, you heard them, it helps you. If you take it to the next level, first the counselor, there are no counselor therapists. You just talk to somebody who's close to you. But now, if it is something serious, our friends or relatives are not able to help you, then, professionals can help you with that issue, right? But everybody should have a person or two in their life that they can talk openly with. You asked a question, do you need doctor? I forgot to answer. You don't need a doctor's referral for psychologist, psychiatrist, for a counselor, but for psychiatrist, you need doctor's prescription or referral. Last question of the day for you, Neet. It's a very big question. You said coconut oil is not good. We have been using coconut oil for years. What do you think about coconut oil? The coconut oil, we call it saturated. We consider it saturated fat. The saturated fat is built in your body itself. We don't consider it fat. If we increase saturated fat in our diet, it's gonna go in there and it's gonna create plaque in your blood. What we call metabolic processes. Your question is: there's some countries, there's some places they've been using coconut oil for years. Even in Punjab, we used to eat a lot of saturated fat, milk, butter, buttermilk. But now our lifestyle here has changed a lot. We don't live in a warm place or hot place, and we don't work as hard. So that's why our saturated fat, we need to decrease it in our diet so that it doesn't go into your body and get stuck there and affects your heart disease. Some people have their coconut oil their whole life and it doesn't affect them, but look at what they did throughout their life and what kind of work they did. I just want to thank all the speakers that you explained everything and answered all the questions so simply and clearly. Now, going forward, there are 2 more door prizes that are left. So I'll ask you to pull the tickets out, and Harleen will pull out a number. And there are 2 prizes that are still pending. Last time somebody got a ticket, so please, I'll give you another second or two. If you're ready, you can give me thumbs up. Many people are ready. First one is 470. And from now on, we sow a seed into everybody's mind about knowledge. And they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PECS, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Singera, Dr. Tarun Sharma, Vineet Kaur, Kashmir Besla, Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Indeep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything, we'll put it on. it on our website www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.